So here we are going to explain what are the content of NCLEX board exam. So NCLEX exam is not divided into the separate content areas. It tests integrated nursing content. Many nursing programs are based on medical model. Students take the separate medical, surgical, pediatrics, psychiatry, and gynae and obstetrics classes. So in our NCLEX board exam, we will get the question from Med-Surg, means medical surgical unit, pediatrics, psychiatry nursing, and gynae and obstetrics. Also, we'll get the question from fundamental of nursing and community health. So here showing some example. So look at the following question. Here's the one of the question explained. So a woman with type 1 diabetes is returned to the recovery room 1 hour after an uneventful delivery of 9-pound and 8-ounce baby boy. The nurse would expect the woman's blood sugar to do which of the following? So if I said the keyword in this question, the mother have a type 1 diabetic and give a birth or deliver a baby boy 9 pounds. So the nurse would expect the woman blood sugar. So after the delivery or before delivery, what are the change in blood sugar? It will be increased or it will be decreased. What? So number one, change from 220 to 180. So hyperglycemia to hypoglycemia. It is not hypoglycemia, but it is reducing. Number two, change from 110 to 80. Change from 90 to 120 milligram per DL, or change from 100 to 140. So first of all, they said, is this an obstacle questions and a medical surgical question? For this question, you can fit for Med-Surg. Why? Because this is a question about the endocrine system, diabetics. This question you can fall or you can categorize in gynecology and obstetrics because the women give a delivery a baby boy. So it can cover both. So in order to select the correct answer is the 2, the change from 110 to 80. So you must consider the pathophysiology of diabetics along with principle of labor and delivery. And this is the example of an integrated question. So we have to coordinate, right, in all systems. So maybe this mother, blood sugar 110, but it will be reduced to 80 milligrams. It is also hypoglycemia. So it is very important to prevent the hypoglycemia in a patient like this. So now showing the client need 1. So category type 1 question. So we have to get a question in NCLEX board, safety and effective care management. Okay, so the first subcategory for this client need the management of care, which account for 20% of question in NCLEX. Nursing action there that are covered in subcategory include. So safety and effective care environment or management care, we will get question from these topics in NCLEX board, and it includes advanced directives, nursing advocacy, case management, client rights, collaboration with interdisciplinary team, concept of management, confidentiality and informative security, and also consultation. So all of them is the part of fundamental of nursing. But fundamental of nursing basically under safe and environment, effective care environment or management care. Fundamental of nursing also cover the subtopic like this, like continuity of care, delegation, established of priority, principal ethics of principal, information technology, informed consent, legal rights, and performance improvement, means evidence-based practice. Also referral and supervision, it is part of delegation as well. So it is also the part of fundamental of nursing. So in NCLEX board, basically when you get your performance score, you'll get safe and environment care and effective care. That is actually fundamental of nursing. A question here. Here is an example of a typical question from management care subcategories. So they said here, which of the following assignment by RN would be appropriate for an LPN and or LPN? So this is the question about the delegation. So which of the following assignment is the assignment by the RN would be appropriate for LPN? So which one LPN can take care of, right? Out of 4 patients. So first of all, he is saying a 34 years old woman with a low back pain, scheduled for myelogram in the afternoon. Number 2, 41 years old woman in a traction with a fractured femur. And number 3, 43 years old mother newly diagnosed with type 1 diabetes. Number 4, a 56 years old man with emphysema scheduled for discharge, right, later today. So let me explain one by one. I want to start from number 4. So number 4 is not an answer. Why? You see, out of 4 patients, who is stable and LPN can take care of this. So first of all, you have to know what are the rule of LPN. So LPN provide the care to the client in stable condition under the supervision of RN or other healthcare provider. But sometimes they can perform the basic therapeutics or preventive care and also rehabilitative procedure like sterile dressing or urethral catheter or NG tube insertion or application of restraint under supervision of RN. Or they can assist the RN with unstable or complex client, but they can assist. I told number 4 is not an answer because patient have a emphysema and also schedule for discharge. So when patient need to discharge, the RN should educate them, right? RN should educate them. So, as I told you, during the discharge, RN educate the patient what they do at home, right? So education portion is very important. Only RN can do this. So number 4 is not an answer because LPN can take care of this. Number 4 is ready to discharge. And keep in mind, if a patient need assessment, RN should do this. Or determining the plane of care, RN should do this, right? Like a patient need discharge, RN supposed to do this. A patient need to admission, RN do take care of this. A patient need transfer, RN take care of this, right? So even the client with a change the condition, right? Who need assessment, RN take care of them. Or a patient came from the operative rooms, fresh post-operative client, aren't supposed to do this. Number 3, a 43 years old woman, newly diagnosed type 1. So newly diagnosed, we need to educate them how to deal, right? Education, aren't supposed to do this. Number 1, 34 years old, low back pain, schedule for myelogram. So myelogram is a procedure. So it is always RN take care of this. And number 2, 41-old women in a traction with a fractured femur. So orthopedics doctor put the traction. Patient will be immobilized. Patient will be complete rest. So LPN can take care of this patient because nothing need to interfere. So here is another example of management care, right? Another example of management care. So here, let me explain. After receiving a report from a night nurse, which is following the client, should the nurse see first. So out of 4 patients, so which one you have to go first? Who means prioritization, right? So let me see, a 31 years old woman refusing the sucral fat before breakfast. So sucral fat, it is a GI medication. So if nurse refuse, so should I go first? It is nothing related to the life threatening. If you be late, your patient will not die. A 40 years old man, left-sided weakness, asking for assistance to the commode. Also, I said it is important to assist them, but your patient will not die if you be late 5 minutes. Number 4, 52 years old women complaining of chill who is scheduled for cholecystectomy. So a patient is ready to go for surgical operation in gallbladder. Suddenly, patient has a chills, means patient is fever. Fever, why? Because of infection. It is important to inform healthcare provider to stop the surgical procedure. It is important out of number 1 and number 2 patient. Number 4, the 65 years old man with a nasogastric tube who had a bowel resection yesterday. So it is not the fresh post-operative client, more than 24 hours, because yesterday have done, right? It is not emergency, not life-threatening, but it is the information you need to inform healthcare provider. So when any prioritization question come in NCLEX board, always try or always you have to think the out of 4 patient. First of all, try to follow ABCD law. What is ABCD law? First of all, I will try what are the patient, uh, uh, I mean, airway. Airway is any kind of obstruction or breathing. What are the condition of the breathing? Any asphyxia or patient need oxygen, airway check first, then check the breathing, right? So breathing, is it stoppage or patient need oxygen? This one. And number C, check for any circulatory problem, means patient is hypotensive or patient is shocked, need IV fluid, any active bleeding need to stop, right? And later check for any other disabilities. This is the one rule. 1-4 prioritization question, try to follow ABCD law. If the question does not follow ABCD law, then try to follow the Maslow's law. Means Maslow's law means Maslow's laws of need, means just follow patient has a pain, or first of all physiological need or survival needs. So patient need oxygen, give them oxygen. If patient is dehydrated, need to rehydrate, give them water. Patient is hungry, then give them food, or physical and mental rest. So if patient under the pain, need pain medication. So physiological need. If patient is okay, then go for the security needs, means protection from harm. Like fire, you need to remove the patient from the fire. Then belongs of need or esteem needs, and lastly self-actualization. So when we answer the question, we always try to prioritization ABCD law or Maslow's need law, right? It helps to answer the question in NCLEX board, particularly prioritization question. And so this said, number 3 is a patient you have to check first. So what are the other area? So next here they said, also we will get the question, the second subcategory of this client need to safety and infection control. So in NCLEX board, we will get the question also from safety and infection control. So which account for 12% of the question in NCLEX board. And nursing actions that are covered in this subcategory. So safety and infection control, like accident and injuries prevention, emergency response plan, then ergonomic principle, also error principle, or error or prevention, handling the hazard and infection materials, home safety, reporting of incidents, events, irregular occurrence, safe use of equipments, security plan, and standard precursor and use of restraint or safety device. So frequently asking areas in under the safety and infection control. So we have a chance to get the question from restraint and safety device, or standard precursor, right? Or transmission based disease, how to control and how to prevent or stop the infection. So now here we are going to see an example of infection control. Here is the example of question of safety and infection control categories. So question here said, the physician ordered a medication called tobramycin sulfate 3 milligram per kg IV 8 hours for 3-year-old boy. The nurse entered the client room to administer the medication and discovered that the boy does not have an identification bracelet. Which of the following should the nurse do? So when a nurse go for give the medication, first of all, it is very important to identification of the patient. We can identify the patient according to their name, their date of birth, right? So we have to check their bracelet. We have to check in our record. So unfortunately, nurse discovered the boy does not have an identification bracelet. Which following should the nurse do? Ask the parents at the child bedside to state their child's name. Number 2, ask the child to say this is the first and last name. Definitely the boy is 3 years old. You can't choose number 2. You can't do this. Ask themselves. Also, number 3, have a co-worker identify the child before giving the medication. Co-worker, we will not do this. Hold the medication until an identification bracelet can be obtained. So this is the correct answer. Ask the parents at the child bedside to state the child name. So here, child name. So the correct answer is number 1. The action will allow the nurse to correct identify the child and enable the name to give medication to time. So you will learn more about the content covered by safe and effective care environment, safety and infection control subcategory. Now, also in our NCLEX board, we will get question. It is actually part 3. We'll get question from health promotion and maintenance. So the client need account for 9% of question in NCLEX board. We'll get from health promotion and maintenance. So nursing action that are covered in this category. So what it is aging process, anti, intra or postpartum care, newborn care, developmental stage and transition. Also, it's covered health and wellness, health promotion, disease prevention, health screening, high risk behavior, lifestyle choice, principle of teaching, self-care, and techniques of physical assessment. So it covers all of this. Promotion. So it is important to understand that not everyone described in the question will be sick or hospitalized. Some client may be in the clinic or home care setting, and some client may not be sick at all, right? And it is necessary for safe and effective nurse to know how to promote health and prevent the disease. So prevention is better than cure. So like my 3 years old boy going to driving a bicycle. But if you put the helmet or knee pad, you can prevent the accident. So it is the prevention. Like my father had a history of the coronary heart disease. My uncle passed away because of cardiovascular disease. I have a chance to develop heart problem. So what I should do, I should concern about the uh, food containing fat. I have to concern about the how to prevent the heart disease, how to prevent the atherosclerosis, right? So it is the prevention. Imagine a patient is diagnosed with diabetes. When a patient is diagnosed with diabetes, then what we could do? We educate patient how to prevent it. Diabetic is a chronic disease. It is not possible to cure, but if you know how to control it, diabetic will not lead any complication, because diabetic is a disease that eat your kidney, bite your heart, and eat your brain and nervous system. But if you control, that is okay. So the prevention is important. So this is the example of a typical question from health promotion and maintenance categories. The question is, a 21-year-old woman is active labor and is admitted to the labor unit. An hour later, the membrane ruptured spontaneously. The nurse observed the glistening white cord protruding from the birth canal or vagina. So I said, this is the common question come from our NCLEX board, right? It is actually we call cord prolapse, and it is the emergency for the baby boy. So we have to know how to deal with this, right? So rupture spontaneously, and I saw the cord prolapse from the vagina. So which of the following is the best option, right? So what we could do, if the cord is prolapse occur, right? So let me show you. Number one, return to the nurse station and place an emergency call to the physician. Administer oxygen by mouths at 10 to 12 liters per minute and assist the mother vital sign. And place the client towel over the cord and get it with the sterile normal saline. Number four, apply manual pressure to presenting part and have the mother assume a knee chest position. So when you see that condition like this or cord prolapse, it is important to check our newborn, right? In this condition, baby chance to develop to get less oxygen, right? Or cyanosis. In that situation, the mother will tell your patient for knee chest position. So if they follow the knee chest position, at least baby can get more oxygen, right? So this is the complication of pregnancies. So, or complication of the delivery. So when we discuss in maternity, we will explain more complications like pregnancy-induced hypertension, maternal hypertension, or maternal hypotension, hyperemesis gravidarum, placenta previa, abruptio placenta, all is complication, and we have to know how to deal with them. And also NCLEX would ask the question from declaration, early declaration, late declaration, and variable declaration because of cord compression or uteroplacental insufficiency or head compression. This is the frequent area NCLEX board asks the question, right? So it is the same. Apply manual pressure to the presenting part and have the mother assume to knee chest position. So knee chest position is very important, and it is increase the blood supply to the baby. So here the nurse must relieve the pressure to the cord and prevent the fetal anoxia, means less oxygen supply. Now, category 3, they said psychosocial integrity. So also I said in NCLEX board, there are 8 areas. Otherwise called psychosocial integrity. How much question will be get? About 9% question in NCLEX board. So it included abuse, negligence, behavioral intervention, chemical or other dependency, right? Like addiction, alcohol abuse, and also coping mechanism like spouse is passed away, how to coping with them. Crisis intervention, so like disaster management, interior, inside disaster, outside disaster, cultural diversity, end of life care, hospice, family dynamics, grief and loss, mental health concept, religious and spiritual influence, sensory and perceptual alteration, stress management, supportive systems, therapeutic communication, and therapeutic environment. So it will be included in our psychosocial integrity portion. Now a question about psychosocial integrity. What are the type of question we get? A 50-year-old man client comes to the nurse's station and asks the nurse if he can go to the cafeteria to get something to eat. When told that, and his privilege do not include visiting the cafeteria, the client becomes verbally abused. Which of the following approach by the nurse to the most effective, right? Sometimes we can see this type of scenario, then what we will do that. So I said, tell the client to lower his voice because it is disturbing to other client. Number 2, ask the client what he wants from the cafeteria and have it delivered to the room. Number 3, they said, plainly but firmly escort the client back to his room. Number 4, assign the nursing assist person, UAP or NAP, to accompany the client to the cafeteria. So this said, number 3, it is cleanly and firmly escort the client back to the room, right? So why we choose number 3? 50 years old man come to the nursing station, ask the nurse if he can go cafeteria to get something to eat. When told that the privilege to not include visiting. So maybe the patient has some psychological issue, safety issues. So then you can stop, but your client is aggressive. They verbally abuse or something offensive word they use, right? And in that condition, what we do, we cleanly and firmly escort the client back to the room. It is psychosocial question. So the nurse should not reinforce because of this behavior, offensive behavior. That client need consistent and clearly defined expectations and limit. Then what next? The 4th category, it is called physiological integrity. So we will get the question from physiological integrity as well. How many questions they come? So physiological integrity subcategory for the client need is basic care and comfort, which account for 9% of question in NCLEX board. And this subcategory include assist directives, elimination, bowel elimination, and urinary elimination. It is the priority, my friend. Or mobility, immobility, non-pharmacological and comfort intervention, right? We are nurses. Non-pharmacological is our first priority. We are not doctor. If we are doctor, we'll think about the pharmacological management, nutrition and oral hydration. Like a patient came because of sickle cell anemia, patient has a pain. Just tell them to take some water, hydration, patient will be okay. Personal hygiene, rest and sleep. It is including the basic care and comfort categories. Or we said this is include physiological integrity. A question, example of one question, a cast is applied to a 9-month-old girl. So cast, orthopedics departments, hand is broken, put the cast for treatment of the Telepedes equinovarus. So it is the congenital problem. So which is the following instruction is most essential for the nurse to give to the child mother regarding her care? Number, offer appropriate toy for this age group 9 months, and also make the frequent clinic visit for cast adjustment. Number 3, provide analgesic as needed. And number 4, do circulatory check for the cast extremity. Number 1 is important. Number 2, also important. Number 3 is needed. Wonderful choice. But super important is number 4. Why? Because if the cast is too tight, that times patient maybe the patient chance to develop stoppage, stop the blood supply right to the local area, or stop the nerve supply, right? So nerve supply, so the neovascular circulation is check the important. We have to check the pulses. We have to check the sensation, fine touch or motor supply or sensory supply. It is the priorities. If have anything impaired, we have to call to the doctor office. My patient, no blood supply, no nerve supply, because if the blood supply stop, nerve supply stop, patient develop gangrene or ulceration and maybe amputation need. It is first priority. So the correct answer, possible complication that can occur after the cast application is impaired the circulation. All of these answer choose might be included in family teaching, but checking the circulation is the highest priorities. So next here, next category, we will learn more about the content, cover the physiological integrity in basic care and comfort category. But the second subcategory of this, the client, is pharmacological. So it means pharmacology and parental therapy. This is the other subcategories. About 15% question we will get in our board exam. So nursing action that are covered. So when in my lecture I take with you, I always give extra focus in pharmacology because a good number of questions come. It includes adverse effect, contraindication of the drug medication, side effect, and interaction. Blood and blood product, central venous access, dose calculation, expected action, medication administration, parental and intravenous therapies, pharmacological pain management, and total parental nutrition include, right? So here one example of pharmacological or parental therapies. A home health nurse is going to start an IV with 5% dextrose in water for 76 years old women. To perform venipuncture, the nurse should start IV with which of the following? So 5% dextrose in water, 76 years old, and perform venipuncture, should start IV. Which of the following is important? The vein of the client rests on the non-dominant side. Number two, the venous of the leg, vein of the leg, so it will not interfere with the client